morning everyone. This is Joyshri Padgiri. Welcome to Advancing Northeast, and today we are here with yet another series, yet another episodes of our talk series. And as we all know that Advancing Northeast has been acting as a platform to bring globally benchmarked professionals from different areas of interest to shed lights on different achievements and developments in Northeast India. And through insightful interviews and in-depth discussions, we aim to showcase the endeavors that are making remarkable contributions towards the development of Northeast. And we are very privileged to sit here today with Dr. Parveez Ubed, a true luminary in the realm of healthcare innovation. Dr. Ubed is the founder and managing director of ERC Eye Care, a sustainable enterprise that has been unwavering in its dedication to providing quality, affordable and accessible eye care solutions to the rural population of Northeast India. So welcome sir, thank
Hi.
you for
Hi,
coming
Joyshri.
to Advancing Northeast, thank you for making time, and it's a privilege to have you here. So sir, we'll start with a little about your background, just about yourself. How would you like to define yourself and everything, please? Please start.
So first of all, Joyshri, thanks for having me here, and I'm glad I'm able to share my experiences and about the industry to advancing Northeast. So about me, by training, I am an ophthalmologist. I have done my post-graduation and MBBS from Guwahati Medical College, and then I am from Jorhat originally. Now I stay all across, like I travel a lot. And post that, I worked for 4 years in various types of eye care setups, non-profit, government, then private, and then later on moved to starting something on my own because I saw a huge both a problem as an opportunity in delivering affordable eye care to low-income populations in the region.
Okay.
Later on, I went on to do my management learning from Stanford University GSB SEED program, which was a very good lesson for me in terms of delivering quality standards in our solutions. And here we are today. So I represent, as you said, a company called ERC Eye Care. We are a phygital eye care solution, which means that we have both digital and physical assets. In physical assets, we have hospitals, stores, mobile vans that go out to people's houses for eye care delivery in the rural areas, as well as Zomato-like bikes where you can order and we can come to your home for a computerized eye checkup.
Okay.
On the digital asset, we have erclens.com, which is a collection of all products and services that are required for your
It's
eye.
a website.
It's a website where you can log in and get accessible information, products, visit to hospital bookings, teleconsultation, everything is available at very affordable cost for all the people.
All the people.
We have seen like 8 lakh people till now, delivered around 2,50,000 eyeglasses, did around 32,000 cataract surgeries across Assam, West Bengal and Bihar, and we have pilot projects in Bangladesh, Nepal and Indonesia. That's
Wonderful, wonderful sir. Like this journey, absolutely, like from where you started and now it's so big already. So it's a very proud moment for all of us. So if I may ask, so what really inspired you to take that step? Like you were an ophthalmologist by profession, but then you founded it on your own, like ERC Eye Care.
Right.
So was there any driving, particular some story or particular driving
course.
factor that inspired you?
So being an ophthalmologist, initially I did not like the subject that much because I thought চশমা কিমান দি থাকিম আৰু মানুহৰ জীৱন, but পিছত realize কৰিলোঁ যে there are 2.2 billion people in the world who currently require an eyeglass but do not have access to it. 2.2 billion globally.
Okay.
There are 65 million people who require a cataract surgery right now are not able to get it because of lot of issues as you mentioned, affordability, accessibility. And the only solution for those people were government setups which were not present, especially in eye care in every location, easily accessible to them. So they had to travel to a civil hospital or a medical college. And for a simple pair of eyeglasses, traveling so much, spending so much money, wasting a complete day, then if they go to private, spending so much money, something I understood was a problem, a pain point for our customers.
Yeah, a huge gap.
Huge
Yeah.
need gap.
Mhm.
And on a personal front, I wanted to do something
On your
that was different
Yeah.
and take the risks. I started very small,
Mhm.
like with a 1 lakh rupees investment from my mother, and converted a kitchen space. She had an additional kitchen, and that I converted in office space with one person
Okay.
with me. Now we are like 267 people full time,
Mhm.
190 part time, and spread across like many places. So yeah, so I was right when I assumed that the problem was big and people would accept our solutions.
Exactly.
And as I went ahead, I got more and more feedback that people
Mhm.
liked our products and services,
Right.
and that inspired me
Inspired you
to go
even
ahead.
more. Right, sir. So if you know the need that why you were starting something,
Yeah.
then automatically the road is
Yeah.
paved.
Yeah.
So, sir, how many years has it been now since
So
you started?
we started with the first hospital in Sibsagar in Assam in 2015.
2050, like that kitchen space of yours. When
No,
you
so
started.
that was the hospital. So it required money,
Okay,
which was given
okay.
by World Bank's Washington DC office to me at that time.
Okay.
Prior to that, so I spent 1.5 years.
Mhm.
I registered the company,
Mm.
but I did not have money or did not know what to do.
Mm.
So basically, I spent lot of time, significant time,
Mm.
conducting camps, going to villages, understanding the people's needs,
Mhm.
what was their willingness to pay,
Okay.
expectations,
Mm.
lot of fears they have. So that understanding, I still think that today whatever we are doing and new people are joining our company, that understanding helps me give that information to them so that we can deliver a better experience to our customers.
Right, right.
I don't call them patients, I prefer calling them customers.
Customers. Yes, sir. So you did your proper amount of research. Like it took
Huge.
almost 1.5 years to
Yes.
take the next
Yes.
step.
What we follow in our company is a process called HCD.
HCD.
It's called Human Centered Design,
Okay.
or H for here,
Hmm.
C for create, D for deliver. So instead of trying to have some fancy idea and solution in my mind, where I just start, oh, etu bhal aru moi kori diu,
Video.
nokori pelai ami HCD principles use kori, understood from the customer
Hmm.
here what the problems are,
Hmm.
then created the
Create
solution,
the solution. Yeah.
and then delivered the same to them. That increase the speed of go to market
Right,
in so
right.
many ways.
Wonderful, sir. So where did you learn all these tactics from?
So I am a medical graduate. I had no clue. So when I started out, I had a few foreign collaborators. In fact, one of the persons who started with me was a person from outside India, from Romania. She and I brainstormed a lot on how I learned a lot from her, number one. Then also I studied a lot of management books.
Yeah.
Trying to
That is important.
I wrote
yeah.
business plans because I knew I need money, angel funding. So
Mhm.
I learned. Then later on, Stanford University, huge value addition to all the terms that I now use. I did not know. আগতে ভাবো যে পইচা কিমান দিব, এতিয়া জানো যে সেইটো উইলিংনেছ টু পে বুলি কয়।
Okay.
তো তেনেকুৱা বিজনেছ টাৰ্মছবোৰ শিকিলোঁ, ষ্ট্ৰাকচাৰ্ড হৈ গ'ল
বিজনেছ
আৰু
কৰিম বুলি ভাবিলে নহ'ব।
এইটো লাগিব প্ৰপাৰ। এটা হ'ল যে স্মল এটা বিজনেছ তুমি আপুনি কৰিব পাৰে, যিটো that business addresses a very small population that is not as scalable. Scalable is whatever you can start in garage also, but the need is so large that you can scale it, that solution. Google, for example, or any other, like McDonald's. Need was there, whatever need, emotional need for McDonald's maybe to eat junk food, but you need scalable, then only you get external funding.
Okay.
Otherwise it's good, you can pretty small start a small clinic. I could have remained there, but I realized that more, if I would have started my own clinic, earlier I planned to open my own hospital, initially one hospital like any other doctor, but I realized that if I practice as a doctor, the maximum number of patients I will be able to see in a month would be 500 to 1000.
Okay.
Because one single person, that's the max.
Yes,
Problem was 2.2 billion. I wanted to contribute a little bit more.
Yeah.
Now we see 18,000 people per month.
Okay. Wow.
One
Huge
single
number.
human being, not possible.
Right.
When the ideas could be written down, business plan created, funding raised, it is possible.
It is possible. Yeah. So, so if I ask you, what are the primary challenges and what responsibilities that you feel that towards yourself, right, when you started and when you learned everything? Because people will get emotionally,
Yes,
they will rely you, and also to gain that trust
Yeah.
from the people. So, how was that journey?
So, I mean, as I said, human centered design gave me all the solutions. For example, when I started out, I did not know how much fees will I take.
Okay.
Then I asked people in the villages, how much are you willing to pay for eye care? 50 rupees. 50 rupees, doctors are taking 400, 500. How is it possible? Okay, but that's what you want to pay, what can I do? Then I went back to the drawing board, talked with my advisors, financial advisors, and saw that if somebody is paying 50 rupees, how many patients will we need to keep it sustainable?
Right. Yeah.
What is the threshold number so that we can pay the rent, pay the doctors, everything, create surgeries out of it, sell glasses. So first, customers' willingness to pay and their intent to take the service, and secondly, whether that worked as a business model. What was the main challenge? Number one. So at that time, I was lucky that I was angel funded by global investors from Los Angeles, India, as well as Europe, who were very experienced people and senior people who told me do this, do that, and I learned a lot. The amount of funding was small, but it was a huge experience. Otherwise, I think I would not have been able to create a bigger solution.
Okay.
So there were many challenges, but yeah, second challenge was funding.
Funding, yeah.
Being in Assam, when you call investors, they say, oh, it's a quote or now it has changed a little bit, but at that time it was difficult.
Yeah.
So I relied on Google. I knew there was a word called angel funding.
Yeah.
I typed, connected one point to the other, that point to the other, and finally we were positioned. We got a sixth position in a business plan competition called Bid Networks in the Netherlands.
Okay.
That was my first big break.
Wow.
Then people came to know about us.
Okay.
Then I was lucky. Then the ERC's Assam story became a very acceptable story to everyone because people thought about it romantically. Oh, hills, underserved, and although I did not much work at that time, I got Sankalp Award. I was featured as an amazing Indian in Times Now.
Okay.
All the World Bank came in from their Washington DC office.
Yes.
They came to my kitchen and said, "Wow, people start in garages. You are starting in kitchen in India."
Yeah.
So this worked for me. So in some ways, being in Assam worked for me.
It worked for you.
Yeah.
Right, sir. So yeah, that also you need to know now how to find your way and how to.
To
you connected with your people basically. So that's
the people
what
today also.
you,
I tell my all team that who is your boss when new people come. They say you are the boss. Boss, our reporting manager. No. The person who can fire you tomorrow is your boss. Like, yes, sir. Who is your boss then? Your patient. Because tomorrow if they do not like you and do not come to you, you are out of business and we cannot meet every day in the office because who will pay the rent? You are fired.
Yes,
so
absolutely.
That's
so the people are the main.
Yes, of course. They are my boss.
Everyone's boss, right? মানুহৰ হকে আৰু
অকে নহলে আমি মানুহৰ আশীৰ্বাদ নাথাকিলে মই ভাবো আজি ডেটত মই ইমানখিনি কৰাটো মোৰ কাৰণেতো মই যোৰহাটৰ সৰু জেগা আৰু ইমান তেনেকুৱা স্মল টাউন গাই তো ইমানখিনি সম্ভৱ নহ'ল এই আশীৰ্বাদটোৱে আগুৱাই গৈ আছো সেইকাৰণে সেইটো এটা মোৰ এলাইনমেণ্টো হৈ থাকে যে আমাৰ অৰ্গেনাইজেশ্যনটো আমি ছ'চিয়েল এণ্টাৰপ্ৰাইজ বুলি কওঁ উই আৰ নট লাইক এ নৰ্মেল কোম্পানী নৰ্মেল কোম্পানী ইজ দেয়াৰ এপ্ৰ'চ ইজ ছিংগল বটম লাইন মানে profitability. Our social enterprises are double bottom line companies. Yes, we need to be profitable, but we need to have proper clear impact. Okay. Our target customer is the base of the pyramid or a low income or a middle income customer. So that customer is our primary customer.
Right. So sir, can you share some success stories, particular some very touching moment that you remember during your profession, anything?
তো আমি এবাৰ ফটো সেশন কৰি আছিলোঁ আমাৰ মাৰ্কেটিঙৰ মেটেৰিয়েলৰ কাৰণে তাৰপিছত আমি আইতা এগৰাকী she was an old lady and I heard that she attended one of our camps and then she got her eyes properly could see from that eye and she was so happy that everywhere we organized a camp near our village she was our promoter, our brand ambassador. She would go and tell people her son were working outside. She had no one in the family. She lived alone. Then I decided to visit her. And I decided to visit her. She showed me. Still I have that photo where she was reading the Bhagavad Gita. And I said, as a 70-year-old lady, it's very important. So চকুৰে দেখি এইটো পঢ়াটো এই ফটোখন এতিয়াও আছে পিছত তেওঁ ইটো অপাৰেশ্যনো কৰালে চকুৰ এণ্ড তাৰপিছত আনফৰ্চুনেটলি অকলে থাকে কাৰণে এবাৰ পানী তুলিবলৈ যাওঁতে শ্বি ৱাজ গোইং টু পিক ৱাটাৰ ফ্ৰম দ্য পণ্ড শ্বি ফেল ইন টু দ্য পণ্ড এণ্ড ডাইড that was one sad story but inspiring in many ways for me.
And that will always stay with you.
That will always stay with me. Then there was one guy, Uno Bora from Tio. So that I show to every new person that comes to the company. Uno Bora, one eye was plastic eye, one was a normal. So when he came, initially I was doing the camp, so I saw him coming. I thought he's coming for his plastic eye. And I knew that there is no solution for plastic eye. So I mean, once he came into it, I told him, Bora, আপোনাৰ এইটো নহ'ব আমি নতুন চকু লগাই দিব নোৱাৰোঁ প্লাষ্টিক মই সেইটো কাৰণে অহা নাই আই ডিডন্ট কাম ফৰ ডেট কেলে আহিছে চ' আই এম এ বাৰ্বাৰ নাপিত এণ্ড আই ডু ডেট মাই শ্বপ ইন আ ৰোড ছাইড চকী এখন দি কৰে যে ৰোড ছাইড দে ছেট আপ আ টুল এণ্ড পিপল কাট দ্য হেয়াৰ নাও এজ আই এম টাৰ্ণিং 40 আই এম হেভিং প্ৰেছ বায়োপিয়া মানে প্ৰেছ বায়োপিয়া তেওঁ কোৱা নাই মই কৈছোঁ that I am not able to see properly near, which is a common age-related problem. Because of that, when I cut people's hair, I am not able to see. I cut here and there, and people get frustrated, and I am losing customers. Because of which, the earlier 500 rupees I was earning per day, I am earning now 0. I don't know if I will beg or what. Then we checked his eyes. He just needed a plus, I think 1.5 presbyopia correction, which costed 200 rupees. We gave him free that one person. Otherwise, not always we give free. But 200 rupees, he bought it and hopefully he was able to work at least for the next 2 years earning a decent income with dignity.
Right.
There are many other stories. I don't have there is time, but there are inspiring stories I share with everyone so that every team member is aligned to what they are doing and they are not confused.
That vision stays.
That seva, that service, that service that lead to the smiles inspires us. So even during lockdown when we didn't have money, we were about to go bust. We were
about to ask that how was the lockdown phase?
Okay.
No, so you can say now.
So in lockdown, so we had 2 crores in the bank. And we knew that we had money only for 4 months to pay rent, salary and everything. Then my finance team came and told me that, sir, if we don't fire people right now or bench them, we will not be able to survive. So when I told them, then what is the option? Well, sir, you have to close down. And I said, oh, acha, close down. Then I think we should identify people who should be fired right now and we'll fire them. Then I slept on the night and thought that today, whoever I am being called to interviews like this one, I get awards and everything is because of my team delivering what the story was to the customer. And today, in a case of problems, if I leave them alone, that is not a right ethics. So I told them that forget 6 months, how much we can survive without firing anyone. They said 2-3 months. Okay then, don't fire anyone. Next morning I told them, I took back my decision and I kept them 2-3 months. Lockdown was over. Patients started, we pivoted to a digital solution. And within next 6 months, we earned the highest revenue in the history of the company, 40% increase and becoming profitable.
Just after the pandemic.
Because the team got motivated and in the pandemic, I think we were one of the most successful companies because we changed to a digital plan and my team got motivated. The company looks after us even though in difficult circumstances. And I think that was a huge good decision for us. And then then investors also got more involved that yes, these guys are doing well, and in fact Netfee again gave me 1.5 crores. So we got back our money in some ways.
So one thing led to the other.
Yes, so good thing lead to good things is what I believe in.
Right, sir. So everybody I think should also learn how to be a good leader from you, because taking the team together and respecting everybody.
It's a very simple rule. I tell my senior leadership also, to become a good leader you don't have to learn, do management lessons, all that. Becoming a good leader is thinking about others before you.
Right.
Because if you think about others, they will think about you. Automatically
you
will improve. Yes.
Right, wonderful. আৰু সেই কাহিনীটো যে আইতাজনীৰ ক'লে খুবেই মানে
এতিয়াও আমি এটা ফটো অফিসত লগাই থওঁ আৰু কেতিয়াবা
It's like you gave her a new world to see because she got that
hope নাছিলে no hope willingness to live better, smile in their face and they were not doing anything free. আমি আয়ুষ্মান কাৰ্ড আছিলে আমিতো ফ্ৰী একো কৰা নাই, কাকো ফ্ৰী দিয়া নাই, উইলিংনেছ টু পে, তেওঁ 200 টকা পিছে দিব পাৰে, 50 টকা দিব পাৰে, সেইমতে মই লৈছোঁ আৰু কেনেবাকৈ ভগৱানে কৰাত মনটো মিলি গৈছে, মানে লছ কৰি মই ডোনেশ্যন বিচাৰি কৰিবলগীয়া হোৱা নাই।
Wonderful, sir. So moving ahead, if I ask you about, since you said you shifted to digital after that, so can you explain a bit about what it encompasses, what are the technique, how did you involve technology and everything, all the advancements?
So initially we had 4 hospitals and mobile vans that operated in the rural areas and vision centers where people can walk to get their eyes cleaned and buy glasses if they need. During lockdown, and that was for low income and middle income people, primarily in rural areas. During lockdown, my mom, she was the first investor in the company. The 1 lakh I told you about, she gave me. I did not have that money at that time. So she told me that মোৰ চকুৰ অলপ problem হৈ আছে, কি কৰা যায়? So the hospital লৈ যাব লাগিলে. But at that, she's 72. I did not want to take her to hospital. And I used to get calls from people, even from rural urban areas, that my mother is sick, that can somebody come to get their eyes checked? And we thought, why not? Then we started that Zomato-like thing where you can order on the app and we can come to your home for free.
Okay.
Check your eyes on a computer, handheld.
I think that is a step not many companies have
Some
taken.
Some do, but for upper income customers.
Okay.
For example, some companies, private tech companies, like only products companies which are interested in selling products to you like glasses, like Lenskart, they do it for urban customers. Ours is a comprehensive. We don't do catering. If we come to your house, if we get your glass, then you get your prescription online. We send it to the cloud, then people check it, our optometrist, then they check it, sign it and give it free of cost. Then you can order online from your home itself. So you come on our app, there is a virtual reality, you can do 3D and see different kinds of frames. So it's a good experience for the rural people. They were wowed by this. And then you order it and our fulfillment center will ensure that it gets delivered at your home. You don't have to step out of the house, which was a huge success for us in the lockdown. In the camps which we were already doing, we were only giving ready-made glasses primarily because we could not go to the campsite again and again. But now because of the tech, people could, we took tablets along with us with cameras. You select, you see in your face how it looks like, order it. Our delivery agents, we have our own supply chain now, last mile delivery, they will come and deliver in your house. So additional people could aspire now to good models, colorful models, which were not possible earlier. That is the second. Third, we started tying up with pharmacies also, doing the same thing. And so one was the home, one was the hospital, then one was the store and mobile vans. So these 4 channels pivoted and the entire customer journey, from the time we contact you, you see our Facebook ad for example, and then you contact us. To the time we go, see in your house your eyes, your mother may have cataract, she comes to our hospital booking, she wants to talk to our counselor. Everything was integrated on our ERP through erclens.com. So now because of this,
so very seamless process,
data backed. We know what is going on.
Yes. So you have
what is Joystree done today? Last year what Joystree did, 10 years back, what was Joystree's problem? Does Joystree like a red glass? Or what does Joystree's mother has? Does she have Ayushman Bharat or any other insurance? Everything is data backed. We have a sea of data, which and it is data of people who are normally data backed, not normally data backed like rural people. Therefore we have worked closely with Ayushman and NRLM as well. So this data-backed system has made it very scalable. Now we go to a new geography. In fact, after all this, it was interesting that during lockdown, because of our success, hospitals from Bihar came to us and told us that you should give us a franchise or something. I said, no, Bihar, আমি আসামতে করব পড়া না বিয়া. But they insisted.
But that was a very big,
big, but it was scary also, little bit Eastern Bihar. Then they told me, no, you please come. Then I went to Siliguri. From there I went to Pune. They gave me security and a car because I said, I'm scared to go to, which is I completely changed.
That way.
I completely changed my mindset after that. After going there, same people like us,
very
kind
welcoming.
people, simple, welcoming. It was the greatest learning experience. Not to have judgments like the stereotypes. And now Bihar is one of our well-performing locations. We are planning to open another 4-5 hospitals.
Wow, that is Very, very
And
inspiring.
I'm also proud of the fact that team from Assam could implement a successful project in Bihar.
In Bihar.
In
yeah.
Bangladesh, people started coming. In Nepal, people started. It was like very.
Absolutely. That was very overwhelming.
Yeah,
also
overwhelming for us, for a
Yeah.
small organization at that time.
Yes, yes.
Yes.
Sir. We'd want to know about how you reach out to the rural people, like your services you said. So how do you really, how is the
Yeah. So, so there we have many types of customers. Some use the smartphone. That is easy to reach out. We use Facebook, social media, Instagram, YouTube, digital marketing. It's an easy process. But
so if somebody from from a village or something, see from my hometown, if somebody contacts you, so how would the process be?
So there are two ways. If that person has a smartphone, he will see our hospital ads on his handles. I mean, whatever he uses, YouTube, Instagram, or Facebook.
Yeah.
Primarily Facebook in Assam. And then he sees us. He clicks. He puts his phone number. Then we have customer support in Guwahati, call center, large call center. They will call and coordinate. They will try to assess how many people. If there are 2-3 people, will send a bike. If there are 100 people, will send a car, van. All those things can happen. If they do not have a smartphone, then so it's a little bit labor intensive. But we use a network of people called camp organizers.
Okay.
Who are part-time workers. We have 190 right now.
Okay.
Who are people working at a community level where people can approach. So that person will know. Will know that there is a camp organizer in my community. If we are operating there, they can contact us and say that Amar Gaon camp eta koribo lage. That person is connected to our community development department.
Okay.
Then that will, at the local level, organize that camp. Go with the van. Do whatever is required. Glasses required. You can take surgery. They will take them to the hospital, base hospital, or do the operation. Send it back to you. And if you don't have any card and all that, before lockdown we had 999 rupees package. In 999, pick up, drop, food, surgery, everything. We made losses, but I don't want to get into why we did it, but it was one of the responsibility also. And not many people did it, but 999, which now has changed to 3,750 post lockdown because of cost structure changes. And also there are other channels, like you can walk up to a store. If there is a store nearby, you can go there. If there is a simple problem, they can solve it there. It's a complicated art. People come on a bike and solve their problem. So that's how we reach out to the customers. So connectivity
and reaching out is always very
yes.
easy. So since we have already covered all the important points, now I would like to shift a little towards in terms of career as a prospect. If we see ophthalmology, what are the scopes in the industry right now? If we particularly take Northeast as a context, how do you see it? Since you have experienced, you have visited all the places, and also what are the skills required, to establish yourself?
So I became a doctor because my parents thought that this is a good profession to have. I studied my schooling in Don Bosco School, Dibrugarh. Don Bosco School, Dibrugarh. I wanted to be an engineer, but my parents said, "This is doctor man bhari ata to doctor." I was forced to, against my wishes, to give medical entrance.
Okay.
Unfortunately, I cracked it and I had to become a doctor. So in Northeast, still I feel the people are not aware of the huge opportunities that are there. They are still stuck on doctors and engineers, especially in smaller towns and rural areas.
Exactly, sir.
Like you, for example, you are into digital. Not many people will not understand ki kore Facebook or ki kore theke. I have from Lower Assam, I think Nalbari, Pulak. He did not have any that much formal education. I think he is not even graduated. But he is one of the best digital marketers I've ever seen.
Right.
He is skilled.
Yeah,
now we have to understand what is skill and what is a formal education. Formal education, I have seen people pass MA, BA, পঢ়িয়ে থাকে অসমত। কিন্তু এটা কথা পাহৰি যায় যে for you to earn money, you should become valuable to a economic process or a company or a government where some economic activity is happening.
Right.
For that economic activity to be happening, you should be able to add value for which people will pay you. And for that, your formal education, unless you are a doctor, engineer or some technical line, it might not be useful. So building skills is one of the most important things everyone doing whatever they are doing, graduation, post-graduation, higher secondary, should keep in mind.
Right.
Even today, people from very good universities in Assam and outside come and join us. We have a management training program of 12 months just to ensure they learn tricks of the trade and become skillful in becoming good managers in the company. Having said that, in eye care, so as I already told you, huge problem. Everybody has two eyes. Everybody by the age they are 35 unfortunately will need an eyeglass to read and see the mobile phone, otherwise they will have to pull it like this, which is a huge market opportunity, and it's wrong to assume that only ophthalmologists 10 বছর পড়িব লাগে medical are doing it. They need support. 2.2 billion people cannot be tackled by one single or any ophthalmologist. They need help. When it comes to health, there are many courses, there are many certificate courses, degree courses, post-graduations. For example, let me start with optometry. Now it's gaining a little bit of traction, but earlier when I started, I had to bring optometrists from Uttar Pradesh when I started in 2013-14. Now they are available. Some colleges are doing it, some eye hospitals are also running courses. It's a very good thing. Optometry is a course they can do 2 year, 4 year, then you can do post-graduation PhD, where you are authorized to do primary screening of eyes, you are authorized to give prescription for eyeglasses, you are authorized to assist the doctor, you are not authorized to do surgery. But this is a certified course where you can do lot of things with optometry. Then these optometrists also need help. In our hospital we have optometrists, 2 optometrists, there are 180 patients. Then there are people called vision technicians. Vision technicians are certificate courses 1 and 2 years, which is approved by National Skill Development Council. People don't do. So then this vision technician course is so good. So what we did initially when we got the World Bank money, I got 25 lakh rupees as a skill development funding, capacity building in 2014. So what I did, I selected people from Okhomor Gaon Rosli. আৰু মই তেতিয়া ভালকৈ কোৰ্সটো কেনেকুৱা নাজানিছিলোঁ, বিবেকানন্দ মিছন আশ্ৰম আছে হলদিয়াত, ডাঙৰ হস্পিটেল কলেজ হস্পিটেল, I got 25 people trained there, and they are earning more than 25,000 rupees in the company right now. Some have gone outside to do other professions also. That is the vision technician.
Okay, so you had that training.
We still do. We still sponsor, give scholarship to people to get trained, because it's always better for me to get a local village Assamese speaking guy or from Bihar, a Bihar speaking guy to serve their own. Even one of the guys, Konseng Mohan, he was high secondary pass from Sibsagar, camp কৰিবলৈ যাওঁতে মাক দেউতাকে ক'লে ল'ৰাটো লৈ ল'লোঁ, কি কৰিম নাজানো, তাৰপিছত ভিজন টেকনিচিয়ান কৰিব পঠালোঁ তাক। সি আহিলে, আজি সি অপাৰেশ্যনছত আমাৰ ছাপ্লাই চেইনৰ কলকাতা অফিচটো চাই সদায়, আজি তাৰ 26 years হৈছে, প্লেনতে থাকে। আজি মুম্বাই গ'ল প্ৰডাক্টছ কিবা, আজি ট্ৰেইনিং দিবলৈ ডিব্ৰুগড় ফ্লাইটত আহিলে। মই তাৰ ষ্টৰি সি নিজে ইনস্পায়াৰ্ড হওঁ যে কিমান ডাঙৰ এটা ডিমাণ্ড আছে, এইটো মানুহে ডক্টৰ পঢ়িব লাগে, ইঞ্জিনিয়াৰ পঢ়িব লাগে, প্ৰাইভেট হ'লেও পইচা দি হ'লেও পঢ়িব লাগে, নহ'লে নাই চেছ কেৰিয়াৰ, সেইটো নহয়। Then there are courses like refractionist who are then again helping the optometrist to do refraction. Again
only for the refraction.
Only for refraction there is a course NSDC approved. Then there is a course called optician where you learn how to make glasses. আমি দোকানত দেখো আনট্ৰেইন মানুহে চশমা এনেকে চাই পাৱাৰটো বনাই দিয়ে, সেই ফ্ৰেমটো লেন্সৰ ফিট কৰে, সেইবোৰো কোৰ্স আছে। If people listen to this video and someone of you see this video and you think that I want to know more about it, please contact us.
Yes, please do.
At ERC Eye Care, you can Google, or you write to erceyecare@gmail.com. We will ensure we respond to you, and if you want to join, we will take you. That's number 1. Secondly, you can always contact this website for Advancing Northeast and contact them. I am sure they will be able to help, and if they are not, I am ready to
connect you with ERC and sir and everything. Any doubts?
So many people we need. I think every year 300-400 people. We are not getting it. Our HR department is running around people in smaller towns. যে তুমি কৰিবা নেকি কোৰ্সটো, আমি স্কলাৰশ্বিপ দিম, তুমি বুজি নাপায় মানুহে, কৰিলে কি হ'ব, মোক আণ্ডাৰষ্টেণ্ড দ্য পটেনচিয়েল।
So, sir, do you think awareness is also somewhere
Of
lacking?
course,
and
people, parents
Yeah.
need to be aware. Teachers,
Hmm.
main teachers in schools,
Teachers.
because parents they are busy in the villages. Teachers should know যে এই conventional line মনে হয় vocational development কৰক তেতিয়া আন ক'ব পাৰিব আজি লেংগুৱেজ জাপানীজ কৈ আছিলে যে কোনোবাই পৃথিৰাজে কৈ আছিলে লেংগুৱেজৰ ওপৰত ট্ৰেইনিং হ'ব লাগে নাৰ্ছ নাৰ্ছিং
Recently, sir, সেইটো আমাৰ পৰা start হৈছিলে এইটো আপোনাৰ career counseling type where we visit these government schools and then we tell them that you have these options available, ইমানখিনি কৰিব পৰা chances আছে. Then the students were coming up and saying যে মই foreign language educator হ'ব বিচাৰো, K-pop star হ'ব বিচাৰো. So that was such an overwhelming experience because now they know such terms but they do not know how to you know go ahead and approach because they হাতখন নাপায়.
I think government school teachers,
Yeah.
there's a thinking just I thought I should share, should be incentivized to educate people in rural, youth in rural about these courses, and if they join something successfully they should be incentivized for that. That will change the whole game. Whole game. There are no many, every time we look out for people in the company, we hire a lot of people. We are not finding the right skill set because they are not trained. Sometimes they are not able to speak English. Lage keteba English. Excel to olop lagi jay keteba. Skill thakile মোৰ হিচাপত চাকৰি ইমান অভাৱ নাই ইমান নাই.
Right, sir. এটো খুব ধুনিয়া মানে কথা আপুনি ক'লে আৰু ইনসেন্টিভৰ because hey mentality
School teacher are the key points.
Teachers are the key
points.
They
people look up to them, and right now if they and if we tell them send they might not be motivated. But if they are incentivized that your next increment will depend on this, then there will be revolution. I am telling you.
Absolutely, everybody listening and watching to this, I think everybody can make something out of the kiba to idea paise. So if this message goes out, kiba jodi kitaba hoy.
I hope so.
Yeah, hopefully we can only be positive.
Yes, of course.
So again, I think that it was such a wonderful, time talking to you. Apuni man key points bilak iman dhuniyake highlight korile, khub bhal lagile. So lastly, would you like to share any message to the, I would not say to the aspiring ophthalmologists only, because also the entrepreneurs, because you are also an entrepreneur. So to the managers and everybody, any message?
So for that, I think I will share the philosophy of my life, which is taken from little bit from Gita, little bit from some saints and monks that I follow. So the three things I think many of you know but are not able to follow properly is, one is detachment from outcomes. Karam karo phal ki chinta. It's key factor in life. Many
Everywhere,
times
like
we are not able to do anything because we are thinking 10 steps ahead. Moi digital marketing kori tapa moi sakori pa na daga mo ki hobo daga mo. No, sorry. You focus on whatever you want to do and detach from that outcome. When I started out, I did not know I will open 10 hospitals, 3, 4, 5, 15 hospitals, I will get funding. How will I know? It's not in my hand. What I knew was that I wanted to do it. It made me happy. I was getting my freedom, whatever I wanted, and I started. Number one, detachment from outcome. Number two, living in the moment. 99% of the time, we are living in a future or a past.
Anticipatory.
Either anticipatory or sad past. মোৰটো আগতে এনেকুৱা নহ'ল আৰু মোৰনো ক'ত হ'ব, বা মই এইটো কৰিলে এইটো হ'বনে নাই, মইতো এইটো নাপালোঁ. লিভিং ইন দ্য মোমেণ্ট, এই মোমেণ্টটোত যেতিয়া মই আপোনালোকৰ ইণ্টাৰভিউটো দি আছোঁ, আপুনি মোৰ ইণ্টাৰভিউ লৈ আছে, উই শুড ডু আৱাৰ বেষ্ট টু গিভ দ্য বেষ্ট নলেজ টু দ্য পিপল, বিকজ দেট ইজ আৱাৰ ইণ্টেণ্ট ৰাইট নাও. Not to think about যে এতিয়া মোৰ কোম্পানীটো কি হৈছিলে আজি মোক বা আপুনি ভাবি আছে নেক্সট মোৰ মিটিংখন. No, we should live in the moment. That will give you best results in life. When you start small business, চাহ একাপো যদি ক'ৰবাত চাহৰ দোকান খোলে, live in the moment makes the best tea so that people love it. And don't think about এই চাহৰ দোকানখন দি মই পিছত বিল্ডিং এটা কিনিব পাৰিম না. Forget about that. Live in the moment. And third, I think, is who am I not to trust. You have lived, you have 2 legs, most of you. You have eyes God has given you. You should be grateful. You have opportunity. You are able to understand and use computer to watch this video right now. So you have already succeeded in many steps of your life. Now trust yourself, then you can move ahead. If you do not trust yourself, nobody else in this world will trust you. Live in the moment, detach from outcome, and ask yourself, who
to
am I
trust.
not to trust?
Not to
These three things always help me even in my down times.
Okay,
This
sir.
is my
Actually এই লার্নিংটো
message.
মই নিজে পাৰ্সোনালিও আপোনাৰ পৰা মানে ল'ব
আপুনি এপ্লাই কৰি
পাৰিছো
চাওক
ইয়া
আপুনি এপ্লাই কৰি
Actually
চাওক
to-
because there will be downs in your life always
Yeah,
up হৈ থাকিব নোৱাৰে
totally.
There will be downs in your
Also,
life.
sir, preaching is a different thing, but practicing is a different thing. But you have been doing like both. You are
Practicing is
practicing
difficult,
it.
I will admit.
Yeah,
Even if I say, sometimes I forget.
yeah. Right.
Sometimes I become, hey, এইটো কাম হ'ল ইয়াৰ পাছত এইটো কি হ'ব?
Absolutely.
যেতিয়া I become stressed,
Yeah.
then I try to get back to my foundation of these three principles
Yeah.
and say, হ'ব একো নাই, হ'ব. I should live in the moment.
That's how you deal আৰু
Yes,
সেইখিনি
yes,
part.
deal it.
Yeah, absolutely. Because ultimately, আমি GA, profession নকৰো. So ultimately, it depends on how you carry yourself. I guess.
Yes.
So lastly, my last thing would be to ask you about ERC now. What is ERC? Is any future plans you would like to share with us? Any advancements?
Right.
Anything?
So, ERC has huge plans. When we started, we wanted to make it big. That's why we call it a startup.
Yeah.
Startup are companies which have a scalable solution that can be applied globally. Not everything is called a startup, by the way, which is misused a little bit nowadays.
Yeah.
But startups, by definition, are companies which have a scalable solution which can be applied globally or address a large problem. So we want, as I told you about different countries, I am trying to do pilots. We want to be the number one service provider for eye care delivery in low-income markets of Southeast Asia, India, as well as Eastern Africa.
Okay.
So think big. Who am I not to trust? কেলেনো ভয় খাব লাগে ভাবি চাওঁ নহ'বও পাৰে নহ'লে নাই detach from outcome নহ'লে নাই code is exam practical detach from live in the moment enjoy যে কৰিব পাৰিম টিমটোৱে বিলিভ কৰিছে and we are raising funds now we are starting I think 12 more locations in Assam this financial year and 5 locations in Bihar and if we get some interested investors also some more projects in Bangladesh and Nepal.
Okay, great. So then we can be positive for a lot of things coming from ERC.
We are very excited about ourselves, even others may not be.
No, absolutely. I am boosted up now. Like I'll be also following ERC.
Sure.
Everybody should in that way. So thank you so much. I would say মোৰ আসলে হেক কৰিব মন যোৱা নাই because ইমান ভাল লাগিছে কথা পাতি.
You are a good interviewer because you keep the flow and you ask the right questions, which is important.
I just try to engage in the conversation because
it's
you supported a lot. So thanks again, sir. And everybody watching us again, please follow ERC Eye Care, and they have these scholarship courses also. Like
they can come.
They can come and approach you through the website, also through us. You can, connect.
Or you can call. You can go to erclens.com, see our phone number, customer care. Call them. I'm interested. They will get back to the HR department.
Yeah. Also vacancies are also keeps coming, right, sir? So somebody wants to work with you, they can also contact that way. So that is one thing, and the video will be available in all our platforms, YouTube and all our social media platforms. So please follow ERC again. Thank you so much
Thank you.
for your time, sir.
Thank you.